Everyone, today we'll discuss about the infertility. What is infertility? If you are unable to getting the pregnant even after 1 year of the trial for pregnancy is called infertility. This criteria of 1 year is applied when your age is less than 35 years old, and but if your age is more than 35 years old, then you should wait only for the 6 month. Now we'll see what are the important steps in getting pregnant. The first is your brain should produce the reproductive hormones which will act on the ovaries. The ovaries should produce the ova and release it, that is ovulation. Your tubes should pick up that the ova inside the tubes. Secondly, the sperm deposited in the vagina should travel through the uterus to the tubes, and in the tubes your sperm fertilizes the egg and the embryo is formed, and then embryo again travel back to the uterus and getting implanted in the uterine cavity. That are the important steps in getting pregnant. Nowadays worldwide there are 60 to 80 million couples every year they are suffering from the infertility. Out of that 15 to 20 million people are in the India itself, that count for almost 25%. Now we'll see what are the causes. In females there are mostly are the ovarian dysfunction, ovulation dysfunction like in polycystic ovarian syndrome, then endometriosis, damage to the fallopian tube like previous surgeries, and if she has taken the previous chemotherapy and radiation therapy, that will again have an effect on the ovulation. In males there are the low sperm count, low motility, varicocele. So how to proceed? The first important step is pelvic examination of the patient. After that we advise the ultrasound to look for the uterus, ovaries and any cyst in the pelvis. Then we look for the HSG, that is hysterosalpingography. One dye is injected in the uterine cavity and the x-rays are taken to see the movement of the dye. It will give an idea about the tubal blockage if any. Then another thing is hysteroscopy. The one scope is introduced through the vagina and the uterus. It will give an idea about the endometrial cavity, endometrial polyps and fibroids if they are in the endometrial cavity. Then is the laparoscopy. The laparoscopy is introduced through the abdomen. It gives an idea about the ovaries and uterus and the fallopian tubes on the external appearance. It is the best tool for the treatment and diagnosis of the endometriosis. Then how to proceed? The basic important step in management in for the both male and female is healthy lifestyle. You should have a healthy diet, healthy weight and healthy lifestyle. It will help to for the treatment of the infertility. In females we generally give the ovulation induction drugs that will help for the ovulation. Then in males also we also give the some medicine for the increasing the sperm count and the motility. Then we'll see what is IUI. This is intrauterine insemination, where the sperms are injected directly into the uterus near the fallopian tubes. It will help in the patient with the low sperm count and the motility. Then what is IVF? In IVF, your eggs are retrieved from the body that kept in the lab along with the sperms. Then sperm fertilizes the egg and the embryo is formed. And after that 1 to 3 embryos are again placed back into the uterine cavity where it starts the growing. After that there is the one ICSI. ICSI is intracytoplasmic sperm injection. It is useful in the patient having very low sperm count. In that, embryologist inject one sperm directly into the eggs where it fertilizes the egg and the embryo is formed. Then what are the complications of all this treatment? First important is complication is multiple pregnancy. You may have a twins, triplet pregnancy during the treatment of the infertility. You may have a miscarriages, premature birth, and the second important complication is OHSS, that is ovarian hyperstimulation. The ovaries become enlarged and tender with the higher doses of the medication used for the ovulation induction. Is there any modification so that we can prevent infertility? Yes, of course. If you maintain your lifestyle, healthy diet, weight healthy, you should exercise, you should avoid addiction like smoking, alcohol. Definitely it will help you to prevent from the infertility. Thank you.